Hi, I'm Jen Zandrin Kizon, and today we'll be looking at TDCS, or transcranial direct current stimulation, and its applications in treating schizophrenia. So with that, here's a short description of what TDCS is. It is a research in progress form of current brain stimulation therapy, and it targets specific parts of the brain to increase or decrease activity in the firing of neurons. So it has the goal of fixing the functioning of unhealthy brain parts back to normal states by balancing activity. And there are two main electrodes used in this machine, namely the anode and cathode, both with different functions. So where they are placed vary with the necessary part that needs an increase or decrease of stimulation. And for schizophrenia, most studies determined that parts for stimulation needed are left dorsolateral prefrontal cortex, or DLPFC, and that of the left temporoparietal junction. So the first study we're looking at is that of Valiengo and colleagues. The trial showed a great improvement in positive and negative syndrome scale scores as compared to those in the placebo group, and a 20% improvement rate for negative symptoms for the TDCS treatment group compared to the placebo group, and these effects even persisted after the follow-up. They found treatment-resistant attitude was associated with lower TDCS effects, suggesting a small possibility for placebo group. And they determined in their study that specific medications could decrease the effectivity of TDCS, and these were for patients taking clozapine, citalopram, and high doses of haloperidol. So with the reason being that medications could change the TDCS plasticity, which can eliminate the anodal excitability or enhancing effects. So the second review of related literature is that of Chen and colleagues, and they looked into recording a case study of TDCS's immediate effects on a 40-year-old woman who's been on antipsychotic medication for 17 years. And they determined the patient was suffering from motor slowing, mild depression, and even reaching the point of immobility, gradually noted over several months. So patient was put on 10 TDCS sessions for consecutive days. An outcome assessment was conducted after the final session, followed by a 1-month follow-up. And they found immediate effects, which included these on the list, with motor function seeming to benefit the most out of them all. And this suggests that the stimulation for the prefrontal cortex could have possibly worked in increasing motor skills. The next study we're looking at is that of Chang and colleagues, and they focused on finding improvements in cognitive insight and neurocognitive functioning. So, wherein cognitive insight in the study refers to the evaluation and correction of distorted beliefs and misinterpretations. In their study, there is replication of findings like that of Valiengo, where they find decreased severity of negative symptoms. But the interesting thing in this study is how they found rapid increase in planning ability and cognitive insight at the start, but found how cognitive insight differences did not change significantly after 1 month of no TDCS. So this shows promise regarding fast-acting beneficial effects of TDCS on cognitive insight and planning ability for people with schizophrenia. So with the previous study looking on neurocognitive function, it has been done before on animals, and results showed improvement in cognitive dysfunctions from restoration of synaptic plasticity in the prefrontal cortex. And previous research also supports the claim in increased planning ability, as Cazalis and colleagues indicated that the left dorsolateral prefrontal cortex is associated with learning effects on planning performances. And it's important to note that though these were all positive news for the clients in the studies, effects for the treatment did not last long. Also, clients mentioned 2 side effects that have always popped up, which were a mild tingling and itching sensation after treatments. So with parts of the brain affected by schizophrenia, most studies focus on stimulating the prefrontal cortex because it's one of the main parts affected by patients with schizophrenia. And evidence of this is found in studies like that of Andreas and colleagues, where they found that patients with schizophrenia had decreased metabolic activity in that area. And since the prefrontal cortex is associated with executive function tasks like decision-making and motor skills, when this area of your brain does not work, people fall into disorganization and behavioral problems. It is also observed that patients with schizophrenia have decreased perfusions in the parietal and inferior temporal cortex and an increased perfusion in the thalamus, cerebellum, and the retrospinal cingulate, which suggests an imbalance in distributed cortical and subcortical circuits. So dysfunctions of these circuits are hypothesized as the cause for symptoms such as hallucinations, delusions, and loss of volition. And so with dopamine, it is the target of antipsychotic drugs, and with the knowledge of the basal ganglia area having the most dopamine, it is affected. Thus, with schizophrenia affecting it, there is a malfunctioning of the part of your brain that reinforces behavioral patterns based on feeling good. Yep, so there's also research by White and colleagues that suggests malfunctions in the limbic system contribute to schizophrenia symptoms, specifically the issues with emotion formation. And he hypothesized that these 5 parts specifically were affected. So with these affected, it caused malfunctions in self-awareness skills, understanding of reality, memory formation necessary in the adaptation of solutions to problems based on previous experiences, and a disruption of a pleasure and reward system that leads to motivations that direct behavior. Yep, so most studies talk about the adequacy of antipsychotic medication, but some clients find it incomplete in terms of effectivity for all symptoms experienced. So this is where TDCS come in, and it increases cortical excitability by balancing of perfusions in the inferior and parietal cortex and other limbic system parts. So other applications is in stimulating the need for brain parts using it to increase activity in the prefrontal cortex to ameliorate the negative symptoms. And Chen and colleagues also found stimulation of these parts helped in alleviating psychomotor slowness and catatonia due to the malfunctions with the limbic system, hippocampus, and DLPFC. Apart from that, they found that focusing on the DLPFC during stimulation increases general cognitive processing, which then restores impaired executive functioning for patients with schizophrenia. And finally, in the collection of research, effects of TDCS is seen in increasing stimulation of the frontal, parietal, and temporal regions to increase cognitive insight abilities and planning skills as determined by Chag and colleagues. So for the recommendations and conclusions, more variety in the severity of illnesses and comorbidity issues should be considered as things that affect treatment. And this also includes determining what other medications may hinder the treatment process. And future research attempts may even try to find the right medication to take together with the TDCS treatment in order to get optimal results. Yep, and in Chang and colleagues' study, they mentioned though there were great results, they were not long-lasting, so longitudinal studies may benefit clients. So studies may find how to sustain the progress or why the effects don't last long. There's also the placebo effect that most studies still need to take precaution against because it comes into issues such as response conditioning and expectancy on results from using a medical device that could affect responses for TDCS's effectivity. And lastly, though there are lots of studies that have replicated results, lots of the trial methods are inconsistent, thus making it hard to compare. Yep, so that's the end of my presentation. Thank you, and have a good day.